Did you know that blood clots can form without you feeling them? These clots can be very dangerous. They can block blood flow and cause serious harm. Even worse, about 3 in 10 people who get a blood clot will have another one within 10 years. Today, we will talk about deep vein thrombosis, or DVT. We will explain what it is, why it matters, and how to spot it early. We will also share 5 key warning signs you should never ignore. If you stay until the end, you will know how to protect yourself and your loved ones. First, what is deep vein thrombosis? DVT happens when a blood clot forms in a deep vein. Deep veins lie under layers of muscle. They are not near the surface of the skin. Most DVT clots form in the legs. Sometimes they form in the arms. When a clot stays in place, it can cause pain and swelling. If the clot breaks free and travels to the lungs, it can cause a pulmonary embolism. This is a life-threatening condition. How common is DVT? In the United States, around 900,000 people get blood clots each year. Up to 100,000 of those people die because of clot-related problems. Pulmonary embolism, which happens when a clot goes to the lungs, causes sudden death in about 1 out of every 4 cases. Often, there are no clear warnings before this happens. That is why it is so important to learn the signs and act quickly. If you find this video helpful, please give it a like and subscribe to our channel. Your support helps us make more health videos for you. Do you know someone who has had DVT? Where are you watching from? Please leave a comment below. We love to hear from you and learn about your experiences. Now let's look at the 5 key warning signs of deep vein thrombosis. Knowing these signs can help you get help fast. Sign 1. Swelling in one or both legs. Swelling is one of the first signs of DVT. A clot blocks blood flow. When blood cannot move, fluid builds up and the leg swells. The swelling often starts in the foot or ankle and may spread to the calf or thigh. You might notice that pressing on the swollen area leaves a small dent that stays for a few seconds. The swelling can get worse after you sit or stand for a long time. Comparing both legs side by side can help you spot even small differences. Sometimes the skin over the swollen area feels tight, like it's stretched too much. You may also feel a sense of fullness, as if your leg is heavier than usual. If the swelling seems to come on quickly or feels very firm, see a doctor without delay. You may notice the swelling feels worse in the evening than in the morning. It can make your socks leave deeper marks around your ankle. Sign 2. Leg pain. Leg pain from DVT is not like normal sore muscles. It often feels sharp or like a heavy weight pressing down in the calf. The pain may hurt more when you stand or walk, and lifting your leg up can ease it. You might feel tender spots when you press on your leg, and the pain can feel like a cramp that won't go away, even when you stretch. It may wake you up at night or keep you from sleeping well. Moving the ankle up and down might hurt more than usual. The ache may spread toward your knee or down toward your ankle as the clot grows. You could notice the pain gets worse after you've been still for a long time. If the pain feels different from any muscle ache you've had before, get medical help right away. You might feel the pain even when you are sitting still. Sometimes the discomfort spreads up toward your hip or down to your toes. Sign 3. Warm skin and redness. When a clot forms, the area around it may become inflamed. The skin over the clot can feel warmer than the rest of your leg. You may also see redness or a pinkish patch that looks blotchy or streaky. The warm patch may spread slowly as the clot grows, and you might feel a gentle burning or itching over the area. Sometimes, the color change is small and easy to miss. Other times, it looks like a bright red area on your skin. You might even notice tiny red streaks that follow the path of a vein. The heat can feel like a low-grade fever just in that part of your leg. If touching the area makes you jump, it's best to have a doctor check it. The redness may fade when you raise your leg and return when you lower it. You could also feel a slight throbbing along the warm area. Sign 4. Visible veins on the surface. If a deep vein is blocked, blood tries to find another route through veins closer to the skin. These veins can swell and look like bulging lines under your skin. They may stand out more when you stand or walk, and they can feel firm or tender to the touch. You might notice them more at the end of the day or after a long flight. They can appear suddenly, as if someone drew thick cords under your skin overnight. Unlike normal varicose veins, these may disappear slowly if the clot dissolves, but they often stay until treated. The skin around them may also feel sensitive or tingly. If you see these new bulging veins along with other warning signs, seek medical care immediately. These surface veins may become more visible after exercise or heat exposure. The surrounding skin may feel slightly numb or tingly. Sign 5. Trouble breathing and chest pain. This is the most serious sign. It may mean a clot has traveled to your lungs, causing a pulmonary embolism. You may feel short of breath, even at rest, and sharp chest pain that worsens when you cough or take deep breaths. You might break out in a cold sweat or feel your heart racing with palpitations. Sometimes you may feel dizzy, faint, or unusually tired very quickly. You may also cough up blood or feel a sense of panic, and your lips or skin may turn blue if oxygen levels drop. The breathing may feel shallow, as if you can't get enough air no matter how deeply you try. Even talking or moving slightly can leave you gasping. If these symptoms appear suddenly, call emergency services at once. Who is at risk for DVT? Some people are more likely to get blood clots than others. Key risk factors include previous blood clots. If you had a clot before, you're more likely to get another one. Long periods of sitting or bed rest, travel by plane or long hospital stays can increase risk. Surgery, especially surgery on the hip, knee, or pelvis. Obesity. Extra weight puts more pressure on veins in the legs. Smoking harms blood vessels and makes clots more likely. Pregnancy. The extra weight and hormone changes can raise the risk. Hormone. Therapy. Birth control pills or hormone replacement can increase clotting. If you have one or more of these risk factors, talk to your doctor about ways to lower your risk. How to prevent and treat DVT. Stay active. Get up and walk every hour if you sit for long periods. Drink plenty of water. Staying hydrated helps blood flow. Maintain a healthy weight. Exercise and a balanced diet can help. Wear compression stockings if your doctor suggests them. If you develop DVT, treatment usually includes blood thinning medicines. These medicines stop the clot from growing and help prevent new clots. In severe cases, doctors may remove the clot or place a filter in a large vein to block clots from reaching the lungs. Early diagnosis and treatment save lives. If you notice any warning signs, do not ignore them. Get medical help as soon as possible. Thank you for watching. If you learned something new, please like this video and subscribe. Stay safe, stay healthy, and we will see you in the next video.